What is a locum CRNA or a 1099 CRNA or a travel CRNA? It is the most similar to being a travel nurse for nurse anesthesiologists. Really, if you break it down, to be locums is just talking about your payment structure. So you are either a W-2 employee, where you are an employee of either the anesthesia group or the hospital, or you are a 1099 employee, meaning that you are an independent contractor. Technical with the actual definition of the word, locums tenens comes from Latin. It means to hold the place. Usually this field evolved from people who were taking like maternity leave or who were out sick for a period of time, having a physician or another advanced practice provider come in and then fill that job slot for a short period of time. But because in the anesthesia world, the average anesthesia provider is over the age of 55 between nurses and physicians, there's a lot of shortages in the anesthesia profession, which leaves a lot of job openings for locums tenens employees. So a couple quick differences really quickly. If you are a W-2 employee of the hospital or the anesthesia group or the hospital, who is your employer, pays your benefits and pays your paid time off and pays for usually your malpractice. You get benefits at a W-2 job. At a 1099 job, or often a locums job, you are an independent contractor, meaning that you pay for both halves of Social Security, Medicaid, Medicare, taxes, and then you also pay your own health insurance and health benefits and your own malpractice and things like that. There are a lot of tax benefits to being a 1099 employee if you are a high wage earner. Do things like contribute on both the employer and the employee side into a solo 401k or a SEP IRA, and usually there is a higher hourly rate that you negotiate with the hospital for providing anesthesia services. Going rates for locums these days are like $225 to $340 an hour. And then you can negotiate additional stipends for cost of living and callback and call and things like that. If you're looking just at the job market in general, I was looking at this since like high school. It's called gaswork.com, where you can see just a bunch of anesthesia jobs that are available. While locums people usually do work like a few months at a time or like a contract, you can negotiate kind of different terms with it. The really big difference to keep in mind is whether you are an employee of the anesthesia group or hospital, so you're a W-2 employee, versus being a 1099 contractor and working for yourself. So you can work 3 months at a time as a locums person, or you can work like 7 on, 7 off, or you can work like per diem 1099. Also, locums agencies and like CRNA travel recruiting agencies, you can either use the agency or not use the agency. Some people like to use agencies because it gives a middleman in between them and the anesthesia group or the hospital, and somebody to kind of speak for you, but they do take a portion of your pay at that point. Big things to think about is W-2 versus 1099 employment.